The number of coronavirus patients in the national capital has crossed 3,500. The Delhi government on Thursday upped its surveillance measures in containment zones, declaring that instead of once, the screening of all people in these areas will be done thrice in 14 days. If screening in any containment zone has not been conducted yet, it will be done within the next 3 days, the government's order said. The Delhi government has also issued guidelines for home isolation for asymptomatic COVID-19 patients and for patients with mild symptoms. Now, for more on this, let's go across to my colleague Akshay Dongre. Akshay, what exactly has pushed the government into bringing in these norms?
Well, as far as the strategy of Delhi government is concerned, containment zone is the forefront strategy, because we have seen that from the day one, the Delhi government has been focusing on isolating these areas from where the cases of COVID-19 have been emerging the most. And when we are talking about the containment zones in the national capital, they increased to the number of 100, and yesterday 2 containment zones have been removed from that list after the Delhi government announced that in the past 28 days, no new cases have emerged. So that is the good news. And that exactly has prompted the Delhi government to now focus more on these containment zones, because we have been watching that yesterday as well in the Chandni Mahal area of containment zone. A few cops who were deployed there have been tested positive for the COVID-19 in areas where the Delhi government has classified as the containment zones. Most of these cases are coming from those areas. So at this point in time, the priority of the government is to focus on these areas, because when we are talking about the population in these 98 containment zones, the population is more than 10,000 people. So if these areas are left unchecked, then there can be a massive outbreak in these areas, which later will be a sign of trouble for the Delhi government. So at this point in time, the Delhi government has clarified that they will be screening each and every person who is living in these containment zones, and in 14 days 3 times at least people will be tested. Earlier, if somebody showed symptoms, if some area had a problem, then only people were screened. But now, in all the 98 areas, in all the 98 containment zones in the national capital, each and every person will be screened in, and people who are showing symptoms, according to that, testing will be done as far as the protocols are concerned. So this seems to be the most important strategy as far as the elimination of COVID-19 from the national capital is concerned.
All right. Thanks for all that information. And according to certain estimates, there are about 5 lakh people staying in these containment zones. So that's going to be a huge jump in testing.